there is a unique care team in place at the Trinity Breast Health Center. It's an all-female team, starting with the medical director and surgeon, Dr. Melinda Haas, who joins me now with a tour of the center. Moline, Dr. Haas, it's wonderful to have you here today.
Thanks, Paula. I'm so glad to be here.
Yes, October, National Breast Cancer Awareness Month. So that's why we're talking specifically about breast cancer in this segment, right? Is that mainly what you do well, that cancer center covers everything, right? The one we're
Yes,
visiting?
it does. But today we're talking about just our unique breast center and the changes that we're making at Trinity to make it better and better for our patients.
Yeah, that's great. That's what we love to hear. So we stopped in the other day, and Dr. Haas and team gave us a tour, and we started with screening. And this is something that we should all do starting at age 40.
That is correct. Yeah, that's still what the American Cancer Society is recommending, is annually after age 40.
Okay. So we're seeing what's going on here. Tell us about this. Is all digital now, isn't it?
Yes. In fact, about 2.5 years ago, Trinity switched over to completely a digital mammography equipment and updated it so that we're in the state-of-the-art technology here.
Are they easier to read that way, or?
I think they are easier to read, and they're definitely more accurate, especially in younger women with dense breasts.
Oh, good. So now then we walked through the cancer center, and I believe we're going to go into to meet Dr. Bird next. Yes, tell us what she's doing.
Well, she's actually using the digital mammography equipment, and she's about to use CAD, which is computer-assisted diagnostics and detection imaging, to show the difference. You can see this is the same patient, and she's pointing to an abnormal lesion and the change. So she's looking at the year before and also
comparing.
Comparing, yeah.
Do you think, is the care better than ever and the detection better than ever?
Oh, absolutely. And of course, if you can detect something with imaging studies, it's going to be a much better prognosis than if a person finds it when it's a larger, more advanced lesion.
Sure. I know that the next place we visited was kind of a consult with the nurse navigator and a patient. Tell us about the role of a nurse navigator now.
Well, the nurse navigator, I think, is a very important role that we're just getting in place at Trinity. We're very excited about Caroline Robinson. I think she was on your show on Monday.
She was just here the other day, and here she is in this video.
Yeah, and she is going to really add a personal touch for each patient so that they know that they are not just a statistic, that they are a person. They're somebody's mom, somebody's sister, somebody's wife, and that they matter to us at Trinity, and they are going to get all the support that they need as they go through each of the steps.
One-on-one, yeah. And then finally there's a patient getting some radiation therapy.
Yeah, we're visiting the linear accelerator, and this is where a patient gets radiation therapy, which is often a treatment, Paula, that's needed in a breast cancer patient and, of course, other cancers as well. And Trinity is excited to be offering the Quad Cities a new linear accelerator here in 2012. It's going to be the only one of its kind available in the Quad Cities, and it is just state-of-the-art treatment.
What I heard about that is that you could get your treatment in like 90 seconds compared to several minutes now.
That's right, absolutely.
Wow, that's big.
Instead of a 20-minute treatment, it'll be done in 90 seconds. And the accuracy is much more accurate than some of the older equipment. So we're very excited about that.
That is great to hear. That here in the Quad Cities, we can get really the best treatment. Do you really recommend, you know, that we stay here? Sometimes we think we have to go somewhere else for treatment.
Oh, absolutely. And there are times when it is important to seek tertiary care centers, but Trinity wants our patients to know that we are delivering excellent care in breast cancer and that we are more than capable of taking care of all of their needs.
Well, you're putting together a great program. I think it's called Cancer Vibe, which I think is a great title. It's this Friday from 3 to 5. Now, is this only for those who've been diagnosed, Mindy, or who is this for?
This is for anybody. It's for the general public. It's for healthcare providers. It's just an educational seminar where there's going to be several speakers. Dr. Bird and myself are both going to be speaking about the role of breast MRI in detection of breast cancer, and several other speakers. And
I know that your pink pajama party is sold out. It's sold out.
Yes, and that's later on in the evening.
So that'll be a lot of fun, too. Well, it was great to have you here today. And thank you for giving us, I think, some extra hope and encouragement for seeking treatment right here. And that, you know, we're finally going to get a handle on this thing.
I'm glad to be
right?
here. Yeah, thanks a lot, Paula.
Thank you, Dr. Haas. All right, coming up next, putting your best face forward this fall. We're talking about the habits for more beautiful skin, starting right now with these products and some other healthy habits you need to start when we come back.